More barangays in Bontoc Mountain Province will be placed under lockdown due to UK COVID-19 variant. This comes as 12 of the 16 new cases of the new variant were detected in the municipality. Health experts are pointing out that there is no evidence yet for a local transmission of the UK variant. They advise the public to await the investigation results as the claim is premature. The IATF is set to meet next week to discuss the impact of easing age restrictions in areas under modified GCQ. But Malacanang has already expressed support for the move, saying it's good for children's well-being. The Philippine Red Cross may now launch COVID-19 saliva testing following the green light from the DOH. The PRC is pushing the alternative testing due to its lower cost and promising results during the trial run. And today marks the first anniversary of the world's first COVID-19 lockdown. It was imposed in the city of Wuhan in China, which is believed to be the origin of the virus. Good evening, I'm Riza Diaz. This is One News Now. This is first on One News. 3 more barangays in Bontoc Mountain Province will be placed under lockdown starting Monday. This after Mayor Franklin Odsi signed an executive order implementing a 14-day localized quarantine in 3 more barangays effective January 25. That's aside from the 2 villages that are already under lockdown after 12 of their residents were found to have the new UK COVID-19 variant. Bontoc Operations Officer Claire Peel said 6 of these patients have been released from the hospital, 3 are self-isolating, while the other 3 are still undergoing treatment.
The mayor will be issuing today the extension of the lockdown of the other 3 central barangays. We also intensified our policies and its implementation in partnership with our local PNP and barangay officials to minimize especially gatherings and movements.
An infectious disease expert clarified that it is premature to say whether there's already a community transmission of the new COVID-19 variant. DOH Technical Advisory Group and member Dr. Edsel Salvana said the local transmission of the new variant cannot be determined yet. Nevertheless, Salvana said the DOH is strengthening its biosurveillance to prevent possible community transmission.
Right now, there's no evidence of that dahil meron po tayong isang cluster lang na alam naman po natin na magkaka-related sila. And then, we have to find where that person, yung siguro kung ano yung common source nun. And then the others, mukhang wala namang onward transmission.
The Philippine Red Cross may now launch its saliva testing for detecting COVID-19 infections. In today's Laging Handa briefing, Health Undersecretary Maria Rosario Vergeres said the DOH has approved PRC's proposal considering the results of the pilot run. But Vergeres stressed that the agency's laboratory experts panel has allowed the Red Cross laboratories only to conduct the alternative COVID-19 test. According to Vergeres, the DOH will need to see first the validation results from the Research Institute for Tropical Medicine before other labs can follow suit.
It was agreed by the laboratory experts panel na pwede nang payagan. Pero ang kondisyon po ng lab experts sa mga Philippine Red Cross laboratories muna gagamitin dahil kailangan pa po nating antayin yung resulta naman po ng validation test ng RITM para po magamit ng iba nating laboratorio sa bansa.
Now, as for the latest figures on COVID-19, the Health Department reports nearly 1,800 new infections. That brings the total caseload in the country to more than 511,000, some 33,000 of which are still active. 54 patients died due to the respiratory disease in the past 24 hours, pushing the death toll to above 10,000. Some 467,000 have been removed from the virus sick list, with 166 new recoveries reported today. The Foreign Affairs Department, meanwhile, confirms 19 new infections among Filipinos abroad. The caseload has climbed to over 13,700, while the death toll stands at 945 and the recoveries at more than 8,000. Now we'll be back with more stories after the break. Keep it here on One News. You're still watching One News Now. I'm Riza Diaz. The IATF is set to discuss next week the possible impacts of the easing of age restrictions to areas with UK variant cases. To give us his take on this development, we have with us on the line former NTF advisor and public health expert Dr. Tony Leachon. Sir, magandang gabi. Thank you for joining us.
Magandang gabi rin. Good evening.
Sir, we would want to know what do we know about already about the impact of the new variant on children or teenagers, as well as high-risk individuals between the ages of 60 to 65 years old?
Well, as we know right now, it came from United Kingdom and it was first determined by scientists, and as articulated by Prime Minister Boris Johnson, it started in September 2020, when 62% of the hospitalizations in London were actually secondary to this new strain we call the B117. And basically, they are usually asymptomatic cases, and mostly below 20, below 30 is a young age group, and deceptively benign, that actually transmit the virus. It's 70 to 80% transmissible. First, it was determined that it's not lethal, but it can actually cause some problems when actually it would affect vulnerable patients, particularly the elderly patients. But yesterday, Prime Minister Boris Johnson of UK said that it can cause also an increase in the mortality among patients. So it's highly transmissible, it's lethal, so therefore it's more dangerous at this point in time. So basically, in a nutshell, this would be the profile of the patients that we have. And we know that we have two index cases, one that a domestic helper that was positive in Hong Kong, and one from UAE. And then yesterday, we got this information that is also a spread to northern Luzon, particularly the Bontoc province.
Sir, you mentioned that because the DOH is considering recommendation to place areas with the new variant cases under GCQ. What do you think of this?
I think it's a good move. That the first thing that they should actually do is control their borders. That would be the most important interventions that we can actually do at this point in time, and then implement a lot of testings and a lot of contact tracings. So we need to secure that particular place so that it can actually not be transmitted to other areas, particularly in northern Luzon, where social mobility is a problem. So I think that's a good move. But I think we need to assume that even if it is not confirmed that there's no community transmission, we should assume with the number of cases that we have right now, that we have it already, and we need to be extra careful. Now, there's nothing much really that we can do except to maintain the health protocols and double our efforts in order to protect right now the citizenry. But one thing that we need to understand is perhaps they would like to rescind the IATF policy of allowing 10 years old to about 15 years old to the malls, because the super spreaders, the children, are considered super spreaders, and they may actually transmit the disease. 3 out of the 16 patients aged 5, 10, and 17, 18 were identified. So as you can see right now, it's true to form that the UK variants are present usually in the younger adults or even in younger children.
So since you mentioned that, do you think there's still a need to balance the economy and health given the recent COVID-19 developments?
To me, it's very simple. We cannot actually reopen the economy fully if we cannot control the COVID cases. It would be impossible to do this. And the best way is really to lower down our cases as we transition to the start of our vaccination program so that we can balance our manpower. The difficulty right now, okay, so the strategy is to be like Singapore. They flatten the curve, and then when they're ready, there's an increase in the acceptability rate. So they're focused right now only on vaccination. So we cannot fight so many battles considering we are an archipelago country, and it would be very difficult to manage a lot of cases.
So in the same issue, would like to have your insight because the palace said today that relaxing age restrictions is, quote, good for Filipino children's physical, social, and mental health. What can you say about this?
Well, on one point, it's good, but it's not on a long-term process. In order to spur the economy, I don't think we need to use the kids right now because I don't think it's very productive. It's actually counterintuitive considering we don't have yet face-to-face school sessions and then we allow kids to go to the mall. And I don't think the presence of kids will actually improve the economy. Now, we can try, of course, doing other things to improve mental health of the kids. Like, for example, periodically on weekends, we can allow them to go to the parks or to other areas where they can actually be with their parents and then, of course, enjoy their weekends. I think there's a sweet spot for this, but to actually allow them to go out to the malls while there's actually a increase in the number of cases, and the reproduction number is actually increased, and the case fatality rate is the greatest since August 2 of last year, I think it's quite risky.
Sir, for your time and for your insights, thank you very much. That was former NTF advisor, Dr. Tony Liachon. Now, today marks the first anniversary of world's first COVID-19 lockdown, which was imposed in the city of Wuhan in China. Wuhan is believed to be the epicenter of the global pandemic that has infected nearly 100 million people and killed over 2 million so far. But a year after, China reported a slight increase in new infections. The country's National Health Commission said 107 new COVID-19 cases have been identified, 90 of which were local infections. Beijing and Shanghai have launched mass COVID-19 testing in some areas as China faces its worst COVID-19 outbreak since March. The total number of COVID-19 cases in mainland China stands at nearly 89,000, while the death toll remains unchanged at over 4,600. Now, here are other stories we're keeping our eyes on. AstraZeneca will cut deliveries of its COVID-19 vaccines to the European Union by 60% in the first quarter this year. According to Reuters report, the decision of the British-Swedish manufacturer was driven by production problems. About 31 million doses will be left from the initial 80 million expected to be delivered to the 27 EU countries by the end of March. The decrease sets another blow to Europe's COVID-19 vaccination drive after Pfizer and BioNTech also slowed supplies of their vaccine to the bloc. The U.S. Center for Disease Control and Prevention reports that severe allergic reactions to the Moderna vaccine appear to be rare. The CDC says such allergic reactions only occur at the rate of 2.5 cases for every 1 million administered Moderna shots. Now, as of early January, 10 cases of the life-threatening allergic reaction, anaphylaxis, were reported out of over 4 million people who received the Moderna vaccine in the United States. And the World Health Organization says it has reached an agreement with Pfizer for 14 million doses of its COVID-19 vaccine. The new agreement will allow vaccinations in poor and lower middle income countries to start as early as next month under the COVAX program. Adding to that, the World Health Organization is also awaiting approval for the distribution of 150 million doses of AstraZeneca vaccine also within the first quarter. Now, for more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. We are One News.